best home treatment for hiatal hernia. First, the summary. Avoid chocolate, caffeine, mint, carbonation, spicy foods, onion, garlic, tomato, heavily fatty foods. Chew slowly. Have smaller meals. Take a walk after you eat. Wait 3 hours before lying down at night. Learn box breathing. I'm going to review it, so just give it a minute. Also, trial intermittent fasting. I'm going to go into more on all of these. Trial betaine hydrochloric acid. Work on your motility. Make sure your gut is moving well and you're not constipated. And then finally, I'm going to teach you a maneuver that we teach all our patients to really help get relief. So let's jump into it now a little deeper. So I listed the foods, not much more to say about that. Those are foods that are going to aggravate you if you have a hiatal hernia. The smaller meals, the basic thing here is that if you're chewing very well, your brain will know that you're satiated, meaning you've eaten enough sooner. If you tend to eat very quickly, you will go faster than that message gets to your brain because it takes about half an hour for that to happen. So putting your fork down between bites, chewing very, very well. The expression is to applesauce consistency. So it's a lot of chewing, but that slows down your digestion and you will learn to get that message of, I've had enough. You don't want to get full with hiatal hernia because your stomach has already got a lot of pressure on it and you don't want to exacerbate that. Walking after meals is brilliant because it gets motility. A lot of times with hiatal hernia, you have what's called gastroparesis, meaning your stomach is not processing the food very well. It's too slow. And so the walk will help motion occur and just help digestion. It's very, very beneficial. This is not running after eating. This is a stroll. This is just a gentle stroll. And right now, I'm in Florida. It's very hot, even at night, and you can stroll through your apartment complex. You can stroll indoors as well. It's just doesn't matter where you're going. Even if you're walking around your living room, that might be boring, but you're just moving. You're on your feet and you're moving slowly. Now, the next thing is you want to wait 3 hours before you go to bed at night to lie flat. You also might find that elevating the head of the bed is helpful for you if you tend to get evening acid reflux during the night, regurgitation of acid. But minimally, you want to wait 3 hours after dinner before you lie flat. Even if you tend to lie flat on the couch and watch TV, same thing. You don't want to do that. Walk after the meal and stay somewhat upright. You don't want to recline for a good 3 hours. So that's going to help a lot. Now, intermittent fasting. It's very helpful to give your digestive tract a break. I like 12 to 14 hours. I don't like to go much beyond 14 hours. This is the research of Dr. Walter Longo, and he says it puts stress on the heart and it puts stress on the gallbladder. If you have hiatal hernia syndrome, you likely already have stress on your gallbladder, so we don't want to aggravate that by going too long. But a nice 12 to 14 hour fast, if it pushes to 15, not the end of the world, but not these 18, 20-hour fasts. That's not for you. So intermittent fasting is good. The gut gets to clean itself out and gets rid of some of the toxins and the built up pressure. So that's really good. You can trial, meaning a trial of betaine hydrochloric acid. You can get that at any health food store. Now, this is to decipher whether you have actually too little acid that's giving you acid reflux and aggravating a hiatal hernia, because that can happen, especially if you're over the age of 40. This is not for you if you have a stomach ulcer, if you have a peptic ulcer. You don't want to do this. Also, if you have an ulcer in your esophagus that's been diagnosed, you absolutely don't want to do this. This is acid, but it's what should be in your stomach. Now, if you don't have either of those, you can do a trial of this with just before a meal and see how you do. If you get a lot of increased acid, obviously that's not for you. You can turn that off by just eating and putting some food in your stomach, and that will abate it. But again, there are those warnings. So consult your doctor if you're unsure. If you're seeing a gastroenterologist, consult him or her. Although I must say that ulcers aside, you want to make sure that they understand that too little acid in the stomach can cause the same symptoms of acid reflux, again, aggravating a hiatal hernia. So I leave that up to you. I'm not giving you a recommendation. I'm just giving you options. Okay. We said intermittent fasting. The next one is supporting gut motility. So with hiatal hernia, you tend to get a lot of increased intra-abdominal pressure within your abdomen. And that's part of what's pushing everything up and causing the hiatal hernia to occur. So gut motility, if you have constipation, doing like a magnesium citrate to get things moving. You can also do deglycerized licorice, which is going to help the overall gut heal. These are chewable. You can do them before a meal. So there's the other thing with motility is you want to make sure you're hydrated. A lot of Americans are not. You also want to make sure you're eating enough fiber, soluble fiber. So you can look up all the foods that entails. But most Americans are very deficient, like over 90% of us are deficient in fiber. And fiber definitely helps the gut move, but you can't be dehydrated because that will make things worse. So you have to have the water. You can trial the magnesium and the fiber. Okay, now let's get to some specifics. I think the box breathing, I'll explain it to you, but it's something you can look up pretty easily. The maneuver is kind of a little special to us, so I want to demonstrate that. But the box breathing is great when you're in fight or flight, and so you're feeling anxious, your heart's pounding, you have shortness of breath. So the box breathing is very helpful for that because it shifts you away from the sympathetic fight or flight into the parasympathetic, which is rest, digest, relax. And hearing that rest and digest and relax, digest is one of the things I just said. So box breathing is great to do before you sit down for a meal because it makes sure you're not in that fight or flight, which is not a good side of your nervous system to be in when you're trying to digest your food well. So it's called a box breathing because there's 4 sides to doing it, 4 aspects to it, just like building a box. And it does shift you into the parasympathetic nervous system. So you can look it up. It's very accessible online. So I won't go into that. But I do want to show you this maneuver. And I'm going to stand up in a moment so you can see the part of me you need to see in order to do this. But let me explain it to you first. What happens with hiatal hernia is your stomach spasms and pushes up on your diaphragm. So your diaphragm spasms as well. So it almost gets like a Charlie horse, like when you have a muscle cramp. And the diaphragm does a lot of important things. Of course, it brings air in and out, so that's pretty critical. But it also acts as another valve or sphincter to keep things down, to hold the contents of your stomach in your stomach. So you have a sphincter or a valve in the esophagus, which passes through the stomach, and that valve is just below the diaphragm. But the diaphragm itself has a ring right where the esophagus passes through. So there's a ring that goes around the esophagus that acts as a valve or a sphincter to hold things down. And when it's in spasm, it can't do that. So this maneuver, as we call it, we don't call it an exercise because honestly, if you have a hiatal hernia, the last thing you want to start doing is crunches, abdominal exercises. So we call it a maneuver to make a distinction, okay, for that. And what you're doing is you're just relaxing the diaphragm. Sometimes people call it a stomach pull down. And that's something that we work on with patients. It's true, but more correctly, it really is reducing or breaking the spasm within the diaphragm so it can relax and it can move properly. And then that helps the stomach relax as well because the stomach can be in spasm and that's why it's pushed up. Okay, so I'm going to demonstrate. You can see the part of me that you need to see. So first of all, my ribs. So if I pull down like that, that's the line of my ribs. And of course, the stomach's on the left. So I'm just drawing a line right below my rib cage. So all this is rib and this is not. Okay, so that's the rib cage. Now you've got your chest bone, your sternum, hard. Oh, soft. That's where you want to be. So right here where it gets soft, so you're between the ribs, you're below your chest bone. And what you're going to do is you're going to push in and up, and then scoop down. So it's a scooping motion that you're doing, and you're pushing in and you're scooping down, and you then follow. I'm on the left side, which is where your stomach is, and I'm following that all the way down. And you should do it on the right side as well, okay? In and scooping down. In a little upward as you push in, and then scooping down. Now, for some of you, that's going to be too much because you've got a lot of guarding, a lot of spasm, and you're like, I can't do this, that's too painful. So for you, I want you to do just a circular motion. You're pushing in, but it's just a circle. And then it's the same thing. You're doing those circles and you're moving your way along under the rib cage, all the way along. Okay? So you can do this several times a day, and you can see if it'll do a variety of things. Sometimes people will burp, you know, a little gas will be released. Sometimes you'll feel, I just feel more relaxed. You know, I'm not so anxious. This can also affect heart palpitations, making them less. You might just feel like you can breathe easier. So remember, the common symptoms of hiatal hernia is not just the pressure and the acid reflux, but also the shortness of breath and the heart palpitations and the anxiety. So this maneuver can really cause that to abate. Now, you're in control. You might find this easier. I did it standing up because, of course, I'm here talking to you. But you can do it lying down as well. For some people, it feels better with gravity sort of helping to pull everything downward. For some people, it's a little too uncomfortable and they feel better on their back doing it, lying down. Whatever feels best for you and gives you some relief, you can do this several times a day. I would definitely recommend it before you eat. Also before going to bed at night. So try this and let me know. See how you do. Now, is this going to be enough to heal everybody's hiatal hernia? No, it's not. These are good advices, and these are tips that we give to all our patients. But a complete program can involve looking at something called dysbiosis, meaning what's happening in your microbiome, which is your 40 to 100 trillion organisms in your colon that's creating inflammation and creating intra-abdominal pressure. There could be toxin levels that are of issue from mold or heavy metal. We could have liver gallbladder issues. We can have pancreas issues. There's a lot of different things we can look at. Also, your vagus nerve, how is that functioning? How are the nerves functioning that are going to the diaphragm and going to the stomach? And, you know, so there's a few more things, quite a few more things that we look at when we do a complete program with patients. But what I've given you is definitely not something that can harm. That the betaine hydrochloric acid, that's the one caveat, right? So make sure you get permission to do that. Make sure you don't have an ulcer. Other than that, this is something that's very, very basic, but very important. You know, here at the clinic, we talk about how, you know, basic lifestyle essentials, they're just foundational and they make a huge difference. So, also, something like food sensitivities, you know, that what I gave you is not going to be able to diagnose that. So anyway, I'm not promising that this is the be-all, end-all, but these are definitely home treatment tips that are very beneficial, and trialing them is brilliant, and see how you do and let me know. So I hope you enjoyed this content. If you did, give it a thumbs up. Consider subscribing to the channel. We're trying to increase our subscribers so that more people can avail themselves of this information. And I appreciate you, and we'll talk soon.